How often should the NIH Stroke Scale be repeated? Have you ever wondered how often the National Institutes of Health Stroke Scale is repeated in a clinical setting? The frequency of this important assessment can vary based on several factors, including the patient's condition and the treatments they receive. Generally, the NIH Stroke Scale is performed at key moments during a patient's care. First, it is conducted on admission to establish a baseline neurological status. This initial assessment is crucial for understanding the patient's condition. After that, the scale should be repeated whenever there is a transfer between care units, such as moving from the emergency department to the intensive care unit. This ensures that healthcare providers have the most current information about the patient's neurological status. Another important time to repeat the NIH Stroke Scale is whenever there is a noticeable change in the patient's neurological condition. This allows for timely adjustments in treatment if needed. During the acute phase of stroke care, the frequency of assessments can differ depending on the care setting. For patients in intensive care units or step-down units, the NIH Stroke Scale is often repeated every 4 hours for the first 24 to 48 hours after receiving treatments like intravenous thrombolysis or endovascular intervention. After this initial period, it is typically assessed daily. In general care units, assessments may occur daily or every 8 to 12 hours, depending on the specific protocols of the institution. For patients who do not undergo any interventions, daily assessments are usually sufficient to monitor their condition. After 7 days, if the patient's NIH Stroke Scale score remains stable, healthcare providers may discontinue repeating the scale. However, it should be restarted if any neurological changes occur. This structured approach ensures that healthcare teams can closely monitor for any deterioration or improvement in the patient's condition, which is vital in managing acute strokes and guiding treatment decisions. These recommendations are based on consensus from stroke centers and standardized nursing protocols, balancing thorough monitoring with practical clinical workflow. The NIH Stroke Scale serves as a standardized, objective measure of stroke severity and complements routine neurological assessments. In summary, the NIH Stroke Scale should be repeated at baseline upon admission, after transfers between units, with any neurological changes, every 4 hours for 24 hours in patients receiving acute stroke interventions, and daily thereafter as clinically indicated. If stable after 7 days, it can be discontinued but should be reassessed if the patient's status changes. This approach aligns with current stroke care guidelines and institutional best practices for monitoring stroke severity and guiding treatment.